Today we're going to be discussing revolutionizing language access, game-changing innovations in healthcare. My name is Catherine Adames. I am the moderator of this discussion, currently the Director of Operations for the Interpretation Services at Effective. I am going into my 20th year in the language access industry. As many of us in this industry, I started as a Spanish interpreter. I am a CHI currently, occupied many positions, including training, quality assurance, supervising, and management of operations. So I am very honored to be joining this group of professionals, and I will go ahead and allow them to introduce themselves. Beatriz?
Hello, everyone. My name is Beatriz Juarez Rivera, and I'm the supervisor for our Language Access Department at Presbyterian Healthcare Services. I've also started as an interpreter. I've been an interpreter for 12 years. Out of those 12 years, 6 years I've been nationally certified through CCHI, and I currently, like I mentioned before, I am the supervisor at Presbyterian Healthcare Services. Pleasure to meet you guys.
Thank you, Beatriz. Javier?
Hello, everyone. Again, my name is Javier Chavez. I am a manager of language access at Children's Health in Dallas. I've been in this industry for over 8 years, worked as an interpreter at various hospitals, and I've had the opportunity to serve as in leadership at 2 hospitals already. I'm also the vice chair of the National Board of Certification for Medical Interpreters, and I'm very happy to be here with all of you.
Thank you so much, Javier. Stefan?
Hi, everyone. Great to be here. My name is Stefan Korataev. I'm CTO of Cloud Interpreter. It's a remote interpreting platform. And I've been in this industry for more than 20 years. And as almost everybody else here, I started out as not an interpreter, but translator, editor, and then moved into quality assurance. And then my focus shifted somehow to optimization, AI, and remote interpretation. So this is what I'm currently doing, and my main interest lies in maximizing the potential of the technology to streamline communication and eventually outcomes for patients, students, and all stakeholders in very complex ecosystems like healthcare and education.
Thank you so much, everyone. So once again, the title of our roundtable is Revolutionizing Language Access, Game-Changing Innovations in Healthcare. So let's begin. I would like Javier and Beatriz maybe to target some of these questions that I will be asking first. From your experience, how does your organization measure and evaluate the impact of language access services on patient outcomes? In addition to this, what metrics do you find most effective, and how is the evaluation process structured?
I can go ahead and start. So where I work at Presbyterian, we start by tracking our patients' preferred language in their electronic medical record. With that information, we assess the number of LDP patients that we have, and we develop daily reports that are sent to our hospitals and clinical leaders. We measure interpreter utilization, and we also set goals for utilization. We collect feedback from our patients via patient surveys, and then we also look at readmissions rates. And for your second questions, the metric that I find most meaningful is readmission rates and patient satisfaction surveys. So the surveys, they tell us the overall patient experience. This includes communication needs. So the surveys also have specific questions regarding interpreter utilization if their language is anything other than English. And then the readmission rates is a good indicator of the quality of care our patients received. If the readmission rates are higher for our LEP patients, this is an indicator that something is not working with our process and will require some sort of revision.
Thank you so much. Javier?
Something that is very important here at Children's Health is to ensure that language access is an integral part of every process that has to do with patient care. So something as simple as starting, because that affects patient outcomes. So something as simple as starting surgeries on time, making sure that we have the resources available, in-person interpreters, as well as the on-demand video interpretation services and the telephonic interpretation services as well. But there's also other efforts. For example, ensuring, that our kiddos are able to be discharged on time, that their parents can take them home as soon as they're discharged, by translating the AVSs and creating processes and check marks to ensure that the after visit summaries, or the discharge instructions, as what we call in AVS here, is not only translated in a timely manner, but it's done so safely. So there's different check marks before a translation not only takes place, but before it's completed, making sure that medication reconciliations are completed, making sure that acronyms are, or that the document itself is not acronym heavy, and it's actually worked into the policy. So and into the process. So if there's an indication that either or the medication reconciliation has not been completed, or there's too many acronyms that it may confuse the parent that's reading this document at home. It gets sent back to the clinical team. That is fixed. It gets bounced back to the translator, and then it's completed. Now, how all of this is measured, I think that's one of the lovely things of language access. Even whether you are in the hospital setting, whether you are an agency, or just a standalone interpreter working out there, the beauty is that it's very, very data driven, very, very data driven. So we keep track of our encounters, keeping track of the start times, the end times, when those requests are coming in, how fast are we getting to them, how many, in the case of the discharge instructions being translated, how many were bounced back because either the medication reconciliation was not completed, or because it was heavy on the acronym, and how long of a delay does that create. But in the end, uh, even though it may create a delay, it's all for patient safety. So that's, I think it's wonderful when we're very much integrated into every aspect of the patient's care.
Thank you both. I really liked when both of you mentioned patient satisfaction. It is very important that we make the actual person in need part of letting us know if the communication or if the language access plan that we have in place is actually working for them. Stefan, do you want to add anything? I think you're on mute.
Yeah, you're right. Sorry. I think it's a bit tough for me to speak about it, right? Because I don't work in healthcare per se, so I'm on the other side. But yes, everything that Javier Beatriz just said that resonates. I think that being able to integrate your language access tools along the way, right? It's paramount. So if you can do that, if you can have access to interpreters, translators, to technology all along the way, and be able to utilize those, it's super important.
Thank you. What is, in your perspective, Stefan, on the role of emerging technologies such as AI and machine translations in transforming language access in healthcare? What potential do these technologies hold for enhancing patient care?
Well, I'd like to maybe take a step back here, right? And just reiterate, I mentioned it in my intro, so that healthcare is obviously a super complex system. So it's probably one of the most complex systems in the world. Well, as far as I know, healthcare in the US. So, it's a very complex system, and also a system where a lot is at stake, right? So you have to be very cautious about your decisions and what you do at every turn, right? And this combination makes innovation in this sphere especially challenging, right? As we all know, because first, you need to be sure that this technology really solves the problem and that it's compliant, et cetera, et cetera. But then, even if you think that something can be changed for the better, right? You cannot always anticipate and foresee what it entails, right? Because the system is complex, a lot of scattered silos in it. And if I change this, what will it lead to tomorrow, right? can it break things for me? And people are, I think, very cautious about technology just for that reason. Uh, so as I mentioned, I came from written translation. So machine translation is my cup of tea and has been for many years. And the machine translation revolution started as early as 2017, right? So it's at least like 7 or 8 years in the making, and people are still very cautious about it in healthcare settings, right? So there is a regulation around it, so people start trying to use it, but there is still a lot of skepticism towards it. Even though we in the industry know that machine translation is now an integral part of everything that everyone does, right? So even if you work with human translators, then very many cases they will use machine translation as at least their productivity tool, right? So this is how things have changed over these years. But in healthcare, it's not so obvious. And so I think the emerging technologies that you mentioned, maybe not so emergent like remote interpreting, right? So phone interpreting has been around for many decades, but still its adoption sometimes is hindered by these concerns. And I think that we can look at this from different angles. Uh, but the talk of the town, I think, has been in the industry about streamlining operations, right? Unifying, so all these scattered disparate systems that we have and hospitals have. So you need to somehow streamline your operations. You need to integrate, otherwise it's getting too tough to innovate, right? And uh, to make your operations more cost efficient and better for your patients. So I think integration is one of the very important aspects of this. So I expect language access tools to be integrated in a more close, in a more tight manner, right, with everything that is being used in the industry, so that you can have access from everywhere. So along the patient journey, so it's tough enough, right, to carry it out for the patient to move them along this line. So if for its patient engagement, you need to reach out, it's tough enough to figure out a way to do it so that it's convenient, right? And then if it's someone who doesn't speak much English, maybe, right? So you need to go elsewhere and to engage some third-party vendor, or you're outside of your typical ecosystem, and so it's getting too complicated. So integration where you can basically call your interpreter translator or your technology, if it's AI, for example, right from your main systems like EMR, EHR systems in healthcare. I think it's super important, and we'll be seeing more and more of that. Then the scope, right? Because yes, human interpreters and human translators still reign supreme when everything else is equal. But what if you don't have one, right? So your scope is severely limited just because you can have access to every possible language, right? So sometimes it's a dilemma. What would you prefer? Having someone or something if it's technology, or nothing, right? So I think that technology expands the scope dramatically with all the caveats that I made before. So you need to be able to add this to your tool set to be able to utilize technology whenever everything else fails you. And then value, right? So yes, again, a human interpreter can provide better interpretation, right, in some settings, but in some other settings, it's quite possible that technology will do the same faster and maybe even better in some ways for your patient. And those three, I think, are easy because integration, for example, it's much easier to integrate technology with other technology than people, right? And but when it comes to compliance, it's getting harder. So I think maybe this is the 1-2 years from now, maybe this will be the main point of contention, right? Because the technology will keep improving, and we'll get to the point where probably it will be able to solve more cases in a satisfactory, successful manner. But then this compliance problem. So can we trust the technology? Can we remain compliant by using it? And I think this will be the crucial point going forward.
Thank you, Stefan. It's very interesting that you mention integration because I know from our experience that sometimes language access is not provided to a patient because there may be lack of training to the staff. And so if they know somehow that they could just click a button and call an interpreter or request an interpreter for services can be, I think, very interesting moving forward for us. Javier or Beatriz?
I can speak a little bit to that. So I believe we can all agree that technology is everywhere, right, in healthcare, and it's here to stay. Technology is fast, efficient, and can help reduce errors. But the way that I see technology is just as another tool, not a solution. So when we talk about AI and machine translation, we have to keep in mind that translation goes beyond linguistic accuracy. It's about capturing the cultural context to ensure messages resonate with your target audience. Let me give you an example. When have to translate straw in Spanish, I have to see who's my target audience because there's like 7 ways of translating that word. So I want to make sure that whenever a patient receives instructions, they don't have to use Google or a dictionary to know what I'm talking about. But I think with the appropriate use of machine translation and translation memories, we can achieve faster turnaround for documents, we can achieve consistency, and also eliminate redundancy. A lot of times we receive the same documents, just dates and names are changed, so I think it can help with that. I believe that for now, machine translation will have to be overseen by a human translator to finalize the project, but it's definitely a good tool to keep. And just for if somebody doesn't know, just be very careful with the free machine translations, such as Google and some of those ones, because they're not HIPAA compliant. So you cannot utilize them. So make sure that whatever you're using is safe, because new technology can also bring problems. So yeah, those are my comments regarding that.
Thank you. Javier?
Um, yeah, I I echo what's already been said. Machine translation or AI in language access is definitely exciting, and it does bring about also a little bit of fear. But at the same time, again, just looking at it from the language access in the hospital setting standpoint, although it is brand new and shiny and amazing, the first thing that comes to mind is how do I operationalize it? Like Stefan said, how do I implement it? How do I operationalize it? How do I remain compliant? Meaning, it's also not as daunting or looming as some people make it out to be, because we still have to be able to remain compliant. And when if and when we bring it on board, it's is as stated before, it's a tool for us to use. It might definitely make things easier and faster for us, but the human translator and the human interpreter is still very much needed, especially, again, speaking for the hospital setting.
I
Yeah.
think hospital settings and everywhere. As an interpreter, I know, and I echo what Beatrice said. There is an aspect that we will never be able to just discard, which is culture. We cannot sit in front of any patient and talk about things as regularly we would. Sometimes also, if we go to technology, I know that if, for example, a doctor is explaining a very big term, the interpreter will say the term and the patient will probably say they don't understand. Does machine translation find another way to, AI somehow, this is what I wanted to say, find a
Yeah.
different way to explain it to the patient, understanding that there is a problem with communication there, and that no matter what terminology I use, the patient is still not going to understand. Is that part of the culture and understanding going to be passed on when it comes to using AI and other tools? And I always like to go back and say it will take many years for technology to move away from what a live interpreter can do and the great work that we can definitely deliver for a patient.
Yeah, absolutely. I totally agree with that, and with everything that Beatrice and Javier just said. So, and this is a very good point that technology is not the solution; it's just a tool. just as language access in general is not a solution, right? It's just a way to improve outcomes, right? So we don't do language access just for the sake of language access. And but by the same token, we don't do technology just for the sake of technology. It's just another tool in your arsenal. And so yes, just you need to learn how to use it in the smartest way possible.
Also, training interpreters on the healthcare side. How does AI help us with that training? I think it is wonderful what it's able to do, and also as interpreters and as management, we have access to translating and just looking up words quicker than what we would if we had just a dictionary in our hands, which was my experience many years
Yeah.
ago.
Yeah. There are also these adjacent areas, right? So we're mostly talking about translation, interpretation, but like note taking, for example, right?
Hmm.
So here we kind of intrude on the turf of clinicians, like physicians, right, nurses. But if we can provide this kind of functionality that would be seamlessly integrated with the interpretation, translation functionality, I think that had a lot of potential to make everybody's life easier. And a lot of startups are working on these, I would say, isolated problems like note taking in healthcare. But if we're able to combine these solutions into one, right, and to make it readily available for everybody, I think this is also something that on the horizon and we'll see it materialize in the coming years.
I agree. Okay, moving on to our next question. Can you share successful case studies or best practices implementing innovative language access solution in healthcare? In addition to this, how do you ensure these solutions are tailored to diverse patient populations and incorporate cultural competency?
I can start with the question. Um, so, in my current role at Children's Health here in Dallas, I this past year for me has been a tremendous learning opportunity, but also has been probably by far one of the most fulfilling because I finally arrived to a healthcare organization where everything in my wish list for language access was checked off. I've only been here for about a year. I'm one of the newest managers. Again, this I'm 8 years into the industry. This is my fifth hospital, my fifth language access department, and I had never, ever seen anything like this before. Um, the the very efficient way of just using the technology, the electronic medical record, which many of you probably already use Epic, to create the self-dispatching system, to for providers to enter their orders on demand for an interpreter, for the interpreters to do self coordination, whether they're stationed or floating in different areas. For the providers to be able to see this, for the providers to be worked into the actual process of, okay, well, I've put in an order. I know that there's really no interpreters just sitting around. That if nobody has attended to my call within 5 minutes, more than likely they're busy, but somebody will come. So what do I do? Do I start with the video? Do I start with the phone, or do I wait? That's really up to them. Um, just how efficient it is, it's almost like, wow, like I can finally sit back because it works. We don't even have a coordinator. I worked in places where I had to play coordinator and the phone is ringing 24/7. We don't have that. There is absolutely no need for somebody to call. That is how efficient this system is. Also, the and I can take absolutely no credit for it because this was something that was created um, by the leaders before me, Melina Kolbeck, our senior director, Edith Segura, and Daniel Franco, who are my fellow managers. This is all of their work, and I finally I finally arrive and get to enjoy it. Um, the process of translating AVSs within the medical record, which I've seen before, but absolutely nobody has what we're doing, which makes it even so more efficient. Now, just getting past all of that excitement, Um, I think one of the most important things is not just creating the process, but sticking to your process and making sure that you're educating and integrating also everybody else, meaning nursing, the physicians, clinical staff, hospital staff, uh, everybody who absolutely has anything to do with language access or getting language access for their patients also needs to be integrated in or brought into the fold. Because if not, it just doesn't work. So education is key. That is how we ensure that our providers and our clinical staff have that cultural competence and also those technical skills. Because in the end, it's also something very technical. You know, poor, for example, residents, medical residents, those poor guys and ladies have to learn so much within a couple of days and they get thrown out into the hospital. And on top of that, they have to learn that very technical skill of how do I request an interpreter in person? How do I get a hold of somebody in via video? How do I get a hold of someone over the phone? All of that needs to be integrated into everybody's training. And that is how we bring about um, the cultural competence overall of the entire organization. And that is how we're able to serve our patients better and remain cultural competent through process, through education, and through kind of like constant reminders or refreshers, you know, every single year. And on, I know probably Beatriz can agree to that. Sometimes it's kind of hard to to get in there to get uh, for language access departments to get a seat at the table when it comes to educating other departments, when it comes to, for example, doing the onboarding, making sure that language access is mentioned in the onboarding, that language access is mentioned in the yearly modules or education that every hospital employee has to do every single year. Here, that is something that is really important, and I think that makes a world of difference compared to what I have seen in the past.
Thank you, Javier.
Yes, I do agree with what Javier said. And, whether we are seeking new healthcare solutions to replace outdated technology or support growth, I think for me, the first step will be asking questions to the users, right? Asking questions to our patients and providers, nurses. So what are the barriers? What are you having struggles with? I think that's the first thing, because we might want to fix something that is not a barrier. And so once you get the feedback from your patients, providers, and the organization, you kind of analyze, your current state, associated costs. I mean, in the hospitals, everything's pricey. You can do like perform a gap analysis, envision your future state. What do you like to accomplish? And then once everything is done, you make sure you conduct demonstration, develop policies and procedures, make sure you're tracking progress, and just to make sure that all these solutions are tailored to the diverse patient populations. Like I said, we might ask the experts. So the experts in their communications are our patients. We might know what they need, but they are really the ones that know what they need, and we just try to meet them there. Let me give you an example of what I mean. So last year, we deployed 100 new VRI devices. We were really excited about them because they were really nice, and we expected the utilization to increase. A few months went by and it wasn't increasing. So then we had a meeting with some of our community members, and they were mentioning, hey, the image keeps freezing. I cannot use it because it's very choppy. And then we met with our IT. We got support from our leadership, and we ended up developing a SSID, which is a new Wi-Fi for language access only. So now all of our devices are on that specific network that dramatically increased the quality of the video remote interpreting. And all this feedback came from the users, right? Because we do not use that technology on a day-to-day basis. So I think it's very important to often meet with your doctors, nurses, and your patients and see what are their struggles, what are the barriers, and based on that, develop a process. Yep.
Both of you described very nicely and in your own words what a language access plan is. You talked about the needs of the workers, the needs of the people who do not speak English, making sure that all the languages that are required for our patients are there and that we're able to service them, either with interpreters who are in our hospitals or with virtual interpreters. You talked about video remote, and that right there is just breaking barriers of communication. Do we issue the notices in all of the languages that our patients need? When they come to the hospital, does the person in the reception area know that we have an interpreting service, either in-house or virtual, that they're able to contact so that they can provide the correct information to that patient walking in and not have them just leave because they don't feel someone is going to help them? Are we training our staff adequately when we're in the hospitals? Are we evaluating the changes that we're making? Because as you said, Beatriz, sometimes we want to change something, but because we think is not working. And when we talk to our staff, the issue is something different, and we don't need to find a solution for that. Are we translating all the documents? Are we providing to the parent to come to discuss about their children? Are we allowing them to also view the patient information in their own language? Are we explaining to the parents of these children that are coming in the information correctly? Translation, interpretation, transcription. Are we providing all these services? And are we, as leaders, explaining to our staff that everything is there for them to use? So it is very interesting to see. And Javier, you're very lucky to be in a hospital, and so are you, Beatriz, in which they understand how important language access is. And not only because it will make people feel good in the sense of, yes, I'm being understood, but also because it is their right to understand everything that is being said to them. I see a lot of questions in our comments. We will get to those questions if they haven't been answered, because I also see answers to those questions once we have concluded this next part.
And Kat, if you don't mind, I would add
Of
a
course.
couple of points to this. Yes, so from a technology standpoint, maybe, right? So I think what Javier and Beatriz described is absolutely true, and general awareness and teamwork and integration again, right? So they trump everything any day. So it's more important than any single technology. But from a purely technological standpoint, so a couple of interesting cases I heard about or was involved in is, for example, AI-enabled language detection, right? When you have someone in your reception area and you don't even understand, so this is not a scheduled appointment, someone just walked in, you don't understand what this person is talking about. You understand their language, so you can use AI if you have a device with the right software. You can use it to identify this language pretty accurately, actually, for many languages, and then connect this person to the interpreter automatically based on this information. You don't have to try and call all your vendors one after the other, trying to figure it out. And also another interesting case that I heard about maybe several months back was one of the large hospitals. It was their internal language access groups initiative. So they implemented Alexa devices right across their facilities, and those devices were just set up in a way that you could also just say, Alexa, connect me to the interpreter, right? And this would initiate the call to the interpreter. So again, interesting case because it comes with a lot of compliance issues, I think, because Alexa would be there, right, listening, and you might not want to have that, but because it was their internal project and they worked with their IT team and were confident that everything unnecessary in terms of Alexa functionality was cut out. So they did that. So I think it's a very interesting case of how you can use technology, and not a very expensive one. The Alexa devices are much cheaper than tablets, for example, right? So you can buy 100 or 200 devices, just put them everywhere where you expect your users to need them, and they would just say, Alexa, connect me to cloud interpreter. It wasn't cloud interpreter in that case, but for example, right? And then it's all that needs to be done. So your hands remain free, and you don't have to. There is no overhead for you. just an interesting case that I think it's worth sharing.
It is. It is very interesting. Um, just curious to know, Beatriz and Javier, in your hospitals, do ASL patients, are they okay with a virtual interpreting, or do they prefer on-site mostly?
I can go first. Our patients prefer mostly on-site interpreters. And I think the biggest thing is that we have to understand for ASL is that this is a 3D language, right? And it's really hard for them to, I guess, get that communication on a screen, on a flat screen, because ASL interpreters utilize their whole body to communicate. And then we have different types of, deaf patients. We have deaf plus, deaf with disabilities, deaf blind. And so there's a lot more than just, people that understand ASL and can probably use a VRI device. So that's why we have to be very mindful. We actually do a lot of training in our hospital regarding like deaf sensitivity trainings, and to really explain to our staff why it's not okay to try to use VRI with everyone. And so if the patient is deaf blind, they're going to need a tactile interpreter. If the patient is deaf and has a disability, most likely they're going to need an in-person interpreter because they need a different type of communication method. Sometimes as well, and I didn't know this, or ASL interpreters kind of taught me this, that just how we have, I guess, accents from state to state, right?
Dialects.
Yeah, the same thing happens for ASL. So somebody here
Mhm.
from New Mexico might have a harder time understanding somebody from New York. So it's a bit more challenging. So how we use the VRI is more of a backup, right? You come in through the ER, they use the VRI device to do the checking, and then our staff is instructed to submit an request for an in-person interpreter. But yes, and most of our patients prefer in-person interpreter.
Thank you.
I think for ASL, for the most part, the in-person interpreter, in-person ASL interpreter is always preferred. Here, working in pediatrics, it is a combination of both. Some of the appointments are handled through the VRI. Some are, depending on the case, goes in person. Also on the preference of the patient or the parent. But previous to coming to Children's, I was a supervisor at Catholic Health Initiatives in Nebraska, CHI Health Nebraska. Um, that is just a completely different world. And again, just like Beatriz said, it goes by culture. So there I was very fortunate to have 8 staff ASL interpreters, but we shared them with 14 hospitals across the state of Nebraska and Western Iowa. And again, now it's working with adults. It was completely different. We had multiple charts flagged of this patient just cannot work with video remote interpreting, and it's for various reasons. It could be preference. It could also be an elderly individual who, even if they wanted to use the VRI, they can't see very well. So now that you have to have
Yes.
some person. There's also because of the history of the deaf or hard of hearing in Nebraska, because the schools for the deaf were there, because ASL interpreting programs were kind of concentrated there, the population grew. So there is they're very well organized with the Nebraska Commission for the Deaf and the Omaha Commission for the Deaf. So again, the culture is very different. I come back, to back home to Texas, and with that same mindset, and even though I worked in other departments here in language access in Texas, I hadn't thought about it. And then it was kind of like maybe a back to normal where there was just not so much. The need is still there, but at the same time, I didn't see so much of a need for the coordination, because I guess here it's working really well for our patients. Whereas in Nebraska, it was almost like not just coordinating the service of language access, it was almost coordinating the care. It was almost a branch of the department itself, or a standalone branch of the language access department, meaning that coordinator needed to be working both with clinics and with patients simultaneously to coordinate appointments, because almost everything needed to be done in person. So I'm from what I see, it varies from state to state. It also varies um, because of the population, the culture of the population. And what I'm starting to see is that it may also vary between the adult setting and the pediatric setting.
It'll be very interesting to see how technology can assist us in the language industry with ASL, as there is a shortage of ASL interpreters right now in our nation. So I
Yeah,
can't wait to see what
yeah.
people like Stefan will bring for us in the near future.
Well, not necessarily myself. Yeah, I'm not in this field, but yeah, several startups doing that. But I think it's extremely tough for all the reasons mentioned, and I don't expect it to happen soon. So yeah, so I mean, even spoken languages are tough, right?
Mhm.
For VRI, against your connection is choppy, right? Somebody cannot see very well, so what's going on there? Somebody can hear it really well. So yeah, I think ASL is a very, very tough case to
It's
crack.
a tough one.
Yeah.
All right. So moving forward to our next and last question before we read the ones in the comments. What are the key trends in language access that are likely to shape the future of healthcare? And how can organizations proactively prepare for and adapt to these changes? Javier, you want to take on this one first?
Yes, definitely can do that. I think we definitely need to be looking at everything that's trending and everything that is coming for the future of language access. We definitely need to be looking at AI and machine translation. And I applaud everyone who is concentrating on that and doing the research, because the research needs to be happening. The think tanks need to be happening. Everything that is being commissioned is definitely going to be of value. But in looking at this question, especially within the last few minutes, one of the things that I've been thinking about is that w- the part where it says how can organizations proactively prepare is for the future is we need to start actually concentrating on what we haven't fixed yet. What Beatriz stated a little while ago about having to fix the Wi-Fi for the VRIs or the video remote interpreting, uh, that is something that's happening everywhere. I've seen it even in brand new buildings. Um, Still sticking to a very similar story, and not my story. I'm quoting Melina Kolbeck. Is we're worried about AI and we don't even have Wi-Fi. We don't have appropriate Wi-Fi. It's like the Terminator arriving to the 80s and he needs Wi-Fi and he just collapses because it doesn't work. We don't have Wi-Fi. The we have providers that still don't know how to access, the video remote interpreters or the phone interpreters. Um, we still have a lot of issues with the talent pools. As a manager, we have to be constantly recruiting, and sometimes I don't know if I'm between confused or just very very concerned at the lack of talent that I'm experiencing, the lack of knowledge even from people that are actually working in the field, people who are actually working out there as medical interpreters, and they don't even know what the National Board of Certification for Medical Interpreters is, or the Certification Commission for Healthcare Interpreters. They have not once looked into getting certified. The simple fact that there are less than 10,000 or about just 10,000 certified interpreters right now for the medical field from both the National Board or CCHI for the entire nation. Like that's it. That is it. And we pretty much can all guess where the bulk of them are. You know, I think we do need to start concentrating and preparing for the future by fixing or start addressing the things that we haven't addressed or really found solutions for in the last 15 to 20 years.
Thank you, Javier. Stefan?
No,
Sorry, Beatriz.
no, no, you're okay.
That is what they go first. So yeah,
Okay, yes, no, I agree with
you
Javier.
wish.
And I was so excited because a couple of weeks ago, two of my interpreters got national certification. So that makes us 100% certified as of now. I'm hiring, so we might have, the new ones that still need to be certified. But as of right now, we're 100% nationally certified, which is amazing. But some of the key trends that I think we're going to continue to see in the future, it's the collaboration between AI and the human expertise, right? With especially with translators, machine translations, and the memory translations. So memory translations are also widely used. And then I think we also are going to start seeing more VRI usage because, like you said a little bit ago, there's a shortage of interpreters, not just ASL, but overall there's a shortage of interpreters. So we are also relying heavily on over the phone and video remote interpreting. One of the things that I'm hoping to see is speech to text HIPAA compliant apps, because some of our patients that are deaf and they were deaf at a later age, they do not utilize sign language to communicate. So they really rely on written. So we're hoping to see some of those apps come through. And then I think something that we're going to also start seeing is moving past subtitles. I think in the past everything was just done in English and then subtitles. We are starting to do transcription, translations, and voiceover for video, for educational videos for our patients. And I'm hoping that that's the new standard, so every patient receives the same care, right? The same experience. And let's see, I do also think that we're gonna start seeing integrations, like Javier was mentioning, that Epic integration with the healthcare system. So we're gonna probably continue to see this. And I think what organizations can do to prepare for those changes is just assessing and understanding the needs of your patients and stakeholders. We just need to be mindful as well that technology also can introduce errors and get in the way of meaningful face-to-face conversations. But
Thank you, Beatriz. Stefan?
Yeah, well, I think all the main bases are covered, right, in a perfect manner by uh, Beatriz and Javier. So the only thing that I would like to add, maybe two things. So first of all, again, I don't think we can consider language access a thing in itself, right? So it's a means to an end. So we use it to improve outcomes, right? And so and from that standpoint, language access should, and I think it is expected to be developing in the same direction as healthcare in general uh, is, right? So again, the need for integration is not because just language access needs to be integrated, because everything in healthcare needs to be integrated, including language access, right? We cannot achieve huge success by integrating language access only and stopping there, right? So we need to keep doing that for other areas of healthcare as well. So language access just needs to keep abreast with these changes that are already happening and will be happening. So this is one point. And the second point is that I'm always a bit concerned and sad when I see that in discussing technology, it seems like inevitably comes to the point where technology is uh, considered uh, threatening, right, humanity. It shouldn't be one or the other, like this Terminator example, right? So it's not the machines or us, right? So and when I talk about technology in healthcare, I think that AI uh, applications and other similar, advanced shiny stuff is much less important than more underlying technologies. Like again, the very same integrations. So it's not something new. You don't need to develop a new technology to integrate your language, your VRI platform with Epic, right? You don't need to do that. It's already, you just need to have the will to do that, right? The budget maybe. But it can be much more transformative than just applying AI randomly just because it's so fashionable, right? And also the same holds true for these machine translation versus human translators or AI interpreter, which is looming somewhere on the horizon, right? So very far from being practical at this moment for most clinical settings, at least. But still, it shouldn't be one or the other, right? Because uh, the translation memory technology that was mentioned, right? So it's yet another example of technology that been in use for many decades now in the translation industry, and only now it's being adopted more widely in healthcare. Just wanting, so it's there is no conflict there, right? Between humans. So even though when you use a translation memory system, it kind of uh, substitutes translations, right? So you can say that it kind of overrides what a translator would do, right? And some translators uh, are always pissed about it because they say that yes, it's the same sentence as before, but I would translate it differently, but you wouldn't let. So technically, it's possible, but usually it's not recommended to change it. So just one example, and uh, AI applications like machine translation, the same. So it's not something that replaces you. It's a productivity tool that you as a translator use and that you need to learn how to use in an efficient manner. And the same AI, the AI. So like uh, those I would say local features, right, that you can use in certain settings just to improve your efficiency, just to make things easier, like language detection maybe, right, here and there. Maybe in some non-clinical settings where it just can't possibly and physically find enough interpreters to help your patients, right? Just to tell them where they need to go, right? Or to gather some basic information about themselves. You can start using it. Why not? It's not like, and again, as Javier mentioned, 10,000 certified interpreters, right? Whatever we do, it's not going to be 10 million, right? So there always there won't be enough interpreters, like never. And so if we use technology, we just facilitate the very same things that we try to accomplish using human workforce, right? So it's just complementing it. It's not replacing it. And I don't expect it to threaten humans anytime soon.
No threat for us is a great tool. AI, everything, technology is a great tool. And hearing Javier and Beatriz speak, I think, always thinking as an interpreter, of course, how can technology assist us in training better staff? How can technology assist us in making sure that we understand the importance of certifying, that we understand the importance of continuing to educate ourselves as interpreters? This is part of our manual. This is part of our code of ethics. And this is what 20 years ago when I was trained, we lived by. How can we adopt technology to make this easier for us? We need interpreters. The immigration in this country is just growing. Many languages that I hadn't heard 1 year, 2 years ago are now being mentioned more. AI is providing some assistance, but how can we train the people who speak those languages? How can we get the material for them to be trained and also become certified for CCHI? Because we are facing an issue right now talking about immigration. Sometimes we find a speaker of a certain language, but then there comes all the laws that do not allow us to use that person. But what tools do I have, technologically speaking, to train that person and make them an interpreter and allow them to assist in communication? This
Yeah,
was a
AI
very,
can be, sorry, Catherine.
no, go ahead.
Yeah, AI can be very helpful in that regard. So
Absolutely.
if you have uh, a data set, like a glossary, right? A lot of materials, maybe those are scattered across your digital assets. So maybe it's a website, some knowledge base that you have, and you want to build a system with where your new interpreters would learn that terminology and practice it. So using Gen AI, generative AI for that, it's not very hard at this point in the development of the technology. So you can build this bot, right, that would kind of basically converse with your interpreters, checking that their terminology is correct, checking that it matches whatever you have in your knowledge base, right? And I think it's a terrific tool.
I agree. Okay, so let's. Go
Can I
ahead,
just add
Leslie.
something?
Of course.
And I think it's really important to know that these tools are for language professionals, right? Because I think also the risk comes whenever somebody just goes to one of those free machine translations and nobody reviews the document and then just hands it over because they think it's accurate. So I think that's why there's a lot of pushback on machine translations. But if used with a professional translator or a professional linguist, I think we can definitely certainly use technology as a tool. But it
Yeah.
just we have to make sure that just like we take a blood pressure and give that reading to the provider and they'll know what to do with the reading, right? It's the same thing with translators. We get the translation from the machine translator, but then we know if it's good to go or if we have to modify it. So
Yeah.
as professionals, that's kind of our role, but we really need to educate on the staff that they shouldn't be using the these other machine translations that are free out there.
I
That's very
agree.
because just machine translation alone, at least for healthcare, it is a very important tool for a language access, or a translator for the expert, which is the
Yeah.
human translator himself, because at least in the hospital setting, with the regulations that we're bound by, the translators that are in house, or whether you are outsourcing it, the language access department, if let's say it's a discharge instruction that's being translated, the language access department is basically certifying that this translation is good to go. But if now you transfer that to, let's say, a physician or anybody doing that using Google translating it and then handing it to the patient, what that provider, who is maybe a monolingual, what now they have done is, I'm certifying that I myself certify that this translation is good to go, but yet they're not a translator. They're not. And that's when I mentioned before, is how do I operationalize it? It's wonderful, and we do need to learn how to use it, but there's so many things that we need to think about when you're onboarding it into the hospital setting, because it can be a slippery slope. And I think part of it, that's where some of the fear comes from, because most of it comes from not understanding it, but part of it comes from,
Yeah.
okay, well, how is it going to work? Because now you start thinking of the million and one things that could go wrong.
Yes.
Yeah. But we all need to learn how to do that, right? So how to check, how to keep the technology in check while also using it and not just casting it off because it seems like too dangerous, right? Because these two processes need to go in parallel, right?
Let's use it. Let's use always technology as a tool and understand that our professions are important and that we need to evaluate everything that comes in our hands, even before passing it on. I thought we were going to have more time for answering questions. I did copy all of them, and I will get together with our team so that we can send some of those responses over for you. Javier, Beatriz, Stefan, thank you so much for your time. Thank you for your expertise. This was a very interesting conversation to have, and I will see you hopefully soon. To those of you who have joined us, thank you so much for your time and thank you for your questions.
Thank you. Thank you so much. It was a
Thank
pleasure.
you. Thank you for having us. Bye.
Thank you.